Welcome to Sarasota Vascular Specialists, and today is Whiteboard Wednesday. I'm going to be talking to you a little bit today about one of my most favorite topics and what got me very interested in getting into vascular surgery, and that's carotid arterial disease. Probably one of the most studied entities in vascular surgery, and it's been around for a long time and studied. The initial treatment from a surgical standpoint really started in the 1960s, and when it first became popular to work on this and clean out carotid arteries. And we'll talk a little bit about why that's important with regards to blockages in the carotid arteries. Normal arteries start like this and then can develop a spot in the artery that becomes the source of the deposition of cholesterol and platelets and other types of things that then lead to a blockage. And as it continues to block up, you can also get it on this side, and then you start getting a more narrow pathway. In the carotid arteries, this spews out the material that's in the plaque, little particles that can then go up into the brain and cause a TIA, which is transient ischemic attack. That's reversible, does not cause permanent brain damage. Or you can actually have where a piece breaks off and lodges in an artery up in the brain and kills the cells beyond that artery. That, by definition, is a stroke, and that isn't reversible. How do we stop that from happening? Well, first and foremost, prevention would be avoiding all the things we've discussed before. Tobacco use, alcohol exposure in excess, bad cholesterol, poor eating, they all contribute to the development of carotid arterial disease, and genetics you can't run away from. If that's in your family, you're at risk for having that as well. When somebody is an asymptomatic patient, meaning they haven't had a problem with their carotid artery yet, they may not even know. About 1.5 million to 2 million people a year can have a stroke because they just never got a simple thing called a carotid ultrasound, which I think everybody should have by the time they're at least 55 or older from a screening standpoint, and that can basically show us the blockage. In this picture here, you can see the carotid artery, and this is as the artery comes up in the neck. There's an area of narrowing, and this is the channel that the blood is flowing through. This can then be treated in a couple of different ways. One is either approach through the groin to come up with catheters and get through the blockage and put a device that captures any debris that goes up through the blockage, and a stent goes right in this area here. The problem with that is that you still have to get through the blockage in order to do it. And so sometimes going through the blockage, you can knock something off, and that can go to the brain and cause a problem. The large study that looked at this in the past showed that this was inferior to carotid endarterectomy, which is the standard surgery that's been around since the mid-1960s. The other way is through an operation called a TCAR, transcarotid artery revascularization. That's an operation where we make an incision below, just above the clavicle and below where the blockage is in the artery. So it's down about here. A device goes inside here that basically will eventually reverse flow. Another device goes in the vein. We hook the two tubes together. There's a trap in between, and then all the flow is reversed. So instead of going up to the brain like it does on transfemoral stenting, the flow's coming like this. So if something breaks off, it doesn't go to the brain, it comes into the trap and it gets caught. Carotid endarterectomy and TCAR have very similar results with regards to stroke risk, which are both less than 1% in the correct hands. But one has anatomic differences than the other, which are beyond the scope of what I'm going to talk about today. This is basically to avoid a stroke. That's the main reason for doing this operation, to prevent a stroke, which can happen into 12 to 15% of the population over the next couple of years in people who have a greater than 80% carotid stenosis. So in summary, we're talking about carotid artery disease. Greater than 80% for asymptomatic disease is what we typically treat. We discussed the types of treatment as either TCAR, transcarotid artery revascularization, or open carotid endarterectomy. And then we also talked about prevention, eating the right things. And of course, symptomatic carotid arteries that somebody has already had an event, those need to be addressed immediately, and they're a relative emergency. Again, Michael LePore here talking to you on Whiteboard Wednesdays, and thanks for letting me talk to you about carotid artery disease. Thank you.